Hey guys, Dr. Bryan Wills coming to you live from Wills Chiropractic. Another great Wednesday. Sun is shining. It's a beautiful day outside. Hopefully you guys are getting outside, get some fresh air and some exercise. This week or this month has all been all about injury and pain. And last week I talked a lot about kind of injuries and things like that. This week I want to talk about pain. And I know people don't like to talk about pain very much, but we sure like to complain about it quite a bit. People always think that pain's a bad thing, but I think after I talk to you real quickly here, you'll see that pain is actually a really good thing for us. So there are three types of pain that typically you're going to have, all right? One is going to be nociceptive pain, which is pain from like damage of tissue. So you sprain an ankle, you cut your hand or your finger or your leg, that's damaged tissue. That pain is called nociceptive pain, all right? Then you have inflammatory pain. Inflammatory pain is when your body's own immune system attacks the cells in your body. So that's going to be rheumatoid arthritis, Crohn's disease, something like that cause inflammation, inflammatory pain in your body. And the last one's going to be neuropathic pain, which means an irritated nerve. Now, obviously, in a chiropractic office, we see all three types of pain. However, we deal primarily with the first and the second one. So the nociceptive pain when you damage tissue, and also the irritated nerves as well. Now, what is pain for? Well, contrary to popular belief, pain is not just a nuisance. Pain actually serves a function. And the function is to help protect us and inform us of what's actually going on inside our bodies. So an example of protection would be sticking your hand on a hot plate. Obviously, the pain there is to get your hand off the plate so you don't damage more tissue. Actually, when you do that, your body can actually perceive pain before even you consciously do and cause your muscles to pull away so you don't damage your tissue too much. Okay? The other one would be informative. So when you sprain an ankle or you injure your low back or your shoulder or your elbow, it hurts every time you move it. The whole reason that it's supposed to hurt every time you move it is so you don't keep re-injuring it, to keep you off of it. So a sprained ankle hurts, you don't keep doing the same motion over and over again. The tissue is damaged, it needs a chance to heal. So pain like that is very, very good for us because it gives us a lot of indications of, number one, what's going on in the body, and number two, protects us from damaging more parts of our body. The issue runs into is that no one likes pain. Everybody wants to be pain-free, and we want to be pain-free yesterday, and we don't have to pay for it all. So what's happened over the last 20 or so years is we've gotten hooked on opioids because everybody decides, hey, I'm just going to go numb my pain up so I don't have to feel it anymore. Not fix the problem, mind you, just go numb it up. And that's why we have so many people nowadays that are addicted to opioids, that are dying from opioids. It's a huge epidemic, that we've kind of forgotten about with this whole COVID thing and everything else, is how many people die every single day just from ODing on opioids. And again, opioids don't ever fix the problem. They just cover up the symptoms. They cover up the pain. So your body can no longer tell you, hey, don't walk on that ankle because it's broken, or don't lift that because your back is still screwed up. The problem with the opioids and cortisone shots and those types of things is it numbs you up so you can't feel it. So then you go out and ram around on the injured parts anyways and end up doing more damage to the tissue. And that leads to chronic pain. Now, chronic pain is when you've had pain for over 3 months. And chronic pain causes a whole cascade of events that's not very good for you, your brain, or your body. Chronic pain actually rewires your brain so that even if the pain of the tissue heals, your brain still perceives pain there. So the cool part is that perception of pain is in your prefrontal cortex. Now, it just so happens that chiropractic care, the adjustments, actually change the way your prefrontal cortex works. That's why chiropractic care is so good and so efficient at helping people feel better and function better because we actually change how the brain works. So what I want you guys to focus on is pain is not a bad thing. It's actually a good thing telling you something's wrong. And if you are having pain, numbing it up is not going to be the answer. We have to figure out what's wrong and fix the actual problem. And as chiropractors, that's what we've been doing since 1885, is finding the actual problem and fixing it, as opposed to just putting a Band-Aid on things and the problem keeps getting worse and worse and worse. So what I'll leave you with is this, and I've used this analogy for a long time, and it's called the pain funnel. So the typical thing with patients that we see is that they'll injure, let's say, their back or their neck or shoulder, whatever it is, and they go to their medical doctor, and their MD says, oh, you just pulled a muscle, and they give them painkillers. It's kind of the standard cocktail that you're going to get when you go see your MD. Not that it's a bad thing, that's just what they do. And the painkillers and muscle relaxers work for a while, obviously, because they kind of numb things up. But in the meantime, you're still, walking on that injured ankle, or you're still using that shoulder, you're still lifting with that back. And the problem gets worse. So when you're out of the painkillers and muscle relaxers, the pain actually comes back with a vengeance. So you go back to your MD, you get more painkillers and muscle relaxers, and they send you to physical therapy. And physical therapy does a great job of strengthening up a lot of tissues around there, right? So then you leave and you feel better, but then you do what most people do, is you don't keep up with the exercises, you don't keep doing what you're supposed to be doing, and you end up doing the same thing over and over again. You injure your back, your hip, your leg, even worse. So you're back in the MD's office again, getting more pain medication, more muscle relaxers, and getting sent to an orthopedic surgeon, where you're standing on the barrel of surgery or lifelong debilitation. And unfortunately, it's most of the time when people come into our office when they've kind of been through that hoop. What I'm pleading with you today is, please pay attention to your pain. Your body's trying to tell you something. Pain is common, yes. It's never normal. It's never normal for you to have leg pain or neck pain or back pain or headaches or stomach pain. If you're having pain in a certain area, your body's trying to tell you something. So instead of ignoring it, instead of taking Advil, instead of taking aspirin, instead of taking opioids, get your butt to the chiropractic office and see what's going on. So you can actually fix the problem before it becomes a chronic, long-standing condition, which is much more expensive to take care of and causes a lot more permanent damage to your body. So hopefully today you guys understand that pain is a good thing. Don't ignore pain, because pain is trying to tell you to do something. So next time you're having an injury or an illness, get your chiropractor immediately. Let's figure out what's going on with you so we can fix the problem and avoid some of the patients that we see that are just so far gone that we really can't even help them. Surgery is the only answer at that point in time. So I hope you guys have some value today. Next week, make sure you tune in on Wednesday, because I'm going to be going over ice versus heat, which is the universal question that every single person has out there, and they usually get it wrong. So tune in next week, and until then, keep living the dream.